So laparoscopic pancreatic surgery is all about using a minimal access or keyhole approach where you make little cuts, and actually we're watching on a screen. You can do the same operation for the patient by taking out part of their pancreas safely. This is challenging because often it requires the surgeon to be very adept in his skills, because not everybody is proficient enough to perform laparoscopic or keyhole surgery. I performed the first laparoscopic pancreaticoduodenectomy, which is one of the most complex operations that removes part of the head of the pancreas, and more commonly is called the Whipple's procedure. And I performed the first total laparoscopic or keyhole approach for removal of the head of the pancreas way back in November 2005. Since then, I passionately developed this aspect of my surgical skill, and I've been able to do this for various other parts and operations on the pancreas. So not all patients are suitable to undergo a laparoscopic or a keyhole operation for removal of part of their pancreas. But in patients where, from the cancer point of view or from the tumor point of view, you can use this approach, then it is been shown to be safe in skilled hands. I have therefore taken on this aspect of keyhole surgery and developed this within our unit and over the past 20 years as a consultant. As a result, I am one of the recognized European experts in laparoscopic or minimal access pancreatic surgery. There isn't an ideal candidate as such for laparoscopic pancreatic surgery. All patients who would be suitable are those who would have tumors that are in the right location, where the operation can be performed safely from the patient's point of view. The patient's size does not matter. Patient's physical fitness does matter. So all of this is common to having an operation, whether it be by keyhole or open surgery. Once the patient is fit for the operation, and if the tumor location allows you to approach this by keyhole surgery, then one can perform a laparoscopic or a keyhole operation for the pancreas. It is important to bear in mind that as somebody who's a European expert, we do follow all the guidelines that we've developed for safe laparoscopic, which is keyhole pancreatic surgery. Stop. It helps to remove tumors from the pancreas. That's the most common reason why the laparoscopic approach is used. And it allows patients, after having undergone the surgery, to recover much more faster. But if there's a tumor in the body or tail of the pancreas, they can undergo a removal of that part of the pancreas by keyhole surgery. If there's a tumor in the head of the pancreas, then you can have an operation where which is more commonly called the Whipple's procedure, and have that part of the pancreas taken out. All of this can be done. With regards to the Whipple's procedure, it is no longer at the moment advised that we should do it by the keyhole approach, and that is as per the international guidelines that have been developed, unless you're participating in a trial which is seeing whether or not this is safe for our patients. So currently, we do not perform a laparoscopic or a keyhole approach for removal of the head of the pancreas. But for all other parts of the pancreas, one can use the keyhole approach for removal of tumors. The approach of taking out part of the pancreas by keyhole surgery is safe in skilled hands. And there are certain principles that one follows, which allows the patient to have a shorter stay in the hospital and have a much better functional recovery. So somebody, for example, undergoing a keyhole approach to removing part of the left half of the pancreas, which is the body and tail, would stay in hospital shorter and would have a functional recovery to get back to full fitness in 4 to 6 weeks, compared to somebody who's having an open operation where the length of stay would be somewhere around 12 weeks, about 10 days, and the functional recovery would be around about 10 to 12 weeks.